Good morning everyone, my name is Gary Doherty and welcome to Team Brief and thank you for coming. So we'll begin with the middle, hopefully if you can't see the screen, hopefully you can see a paper version of the Team Brief. So I'll begin with the three key messages from the board. We had a strategic meeting last week. So three key things the board just wanted me to flag to you this morning. First one is staff survey results which have come out. The survey was done I think last November, if I'm correct. So a few things come out of it. First thing is a very positive message, which is how compared to a number of other trusts, an awful lot of the scores that we've got for our staff survey come out, if they're not in the top 20, then certainly above average. And if you remember, the staff survey covers a whole range of areas, what it's like to work here, whether or not people would recommend it, people's appraisals, a whole range of things come into it. So it's great that we're doing well there. There was one thing that the board pulled out where we come as one of the worst trusts in the country, which is examples where staff have felt either bullied or harassed or indeed faced violence from staff. From patients. So, and that's something where we've been in that position now for a few years. It's not a new thing that. And obviously at the board we had some conversations about why that might be the case, what might be the circumstances that lead to that, why we might have particular challenges in that regard compared to other trusts. But in a sense, whatever the reasons and whatever the explanations, one of the things that the board has said is that certainly when we have the results again next year, we should really try to focus this year on things that we can do, practical things that we can do to try and reduce that. Because staff should not have to face either threat or indeed the actual experience of violence or intimidation from patients, or indeed, I know sometimes it's not the patients, it's their family or their friends. So that's something that we felt strongly about. In terms of those other 2 points there in the middle, strategic review. I'll come in a moment to our cost improvement programme, and indeed we'll pick it up as we go through the team brief. But if you look at where the trust is right now, in many respects we're doing really well compared to the rest of the NHS, but the whole of the NHS has got a massive challenge. And what we know is that if we carry on doing what we're doing, even if we work even harder than we're working now, and that would be a pretty big ask, that carrying on with what we're doing, if you roll forward a year, 2 years, 3 years, then it's going to be very difficult in terms of, both in terms of what we're able to provide to patients, but our financial position. So the gaps that we've got, the gap on finance, the gap on workforce, the gap on quality, in a sense, if you just project forward the current trends, that gap's going to get bigger. And that, therefore, we need to do something about, and it won't be easy, because if there was an easy answer to that, then someone else would have come up with it in the NHS by now, we could all copy it. And indeed, if you look around the world, an awful lot of healthcare systems are struggling to meet demand, meet expectations, particularly if they've got a population that's getting older and that's got a lot of long-term conditions. So that point there on a strategic review, what we've said is that over the next few months really, but certainly the next few weeks as well, we need to get going on this. It's about looking where we are, looking at those gaps, looking at the facts, looking at the information that we've got, doing what you might call a diagnostic in terms of the situation, and then coming up with some new ideas and some fresh ideas, whether that's within this organisation, but in particular how we could work differently with primary care, how we could work differently with social care, and how we can make that add up to a more sustainable situation going forward. So we're not quite clear exactly how we're going to do that, but what we do know is that we want people to get involved in that, because obviously it's a great opportunity to do that, and in terms of those good ideas, they'll be everywhere in the organisation. So watch this space. In terms of this year's cost improvement programme, we have done really well. We've delivered a level that we've never delivered before. For next year, we're looking at a similar level, which again brings me back to that previous point, is that whilst we've got around about 18 million or so plans already in to reduce costs next year, what we know is that then doing that again the year after and again the year after that starts to get very, very difficult, if not impossible. But like I say, in terms of that 18 million, what we do need to do is just get some focus into taking those ideas and those plans and getting started on them. Because if we start on something in April, obviously you get 12 months worth of benefit. If you start on something in December, then you only get a few months worth of benefit. So that's a big focus for us. So those are the three key areas that the board want me to flag up. Now in terms of some legal points, I'm going to start at 1 o'clock for no particular reason. There was the Easter weekend. And indeed, just to reflect that at the moment, the hospital and indeed community services and primary care are all still very, very busy. Certainly in terms of admissions to the trust, in terms of beds. But as I say, throughout the whole system, we are still really in that very challenged time. Although things have been improving a bit. But if you look at the patient waiting times in A&E as the barometer of that system, then it's still very, very pressured. What we do know we've got coming up is Easter, as I've already referred to this morning. One of the reasons I suspect we haven't got so many people in the room this morning is because of Easter. We have a plan for Easter. There's a plan for us for Easter. Primary care are planning for Easter. And I guess what it's about is minimising the impact of a 4-day weekend, trying to make sure that then next week in particular, we can make sure people can get either in to see their GP or other facilities, but obviously they need to come into hospital or they need to be seen by community services, that we can get them seen. So there's a link there for you to click into the Easter plan. Hopefully, for those of you that have been involved in it, you already know about that, but please do have a look at that. EMIS web launch. So last week, I think it was, we launched the EMIS web system for the community services, and that's a really important step forward. For the last couple of years that I've been here, I know that there are some significant challenges in community services in terms of IT. And if you think about it, in any service where you're out and about all the time, then being joined up on LinkedIn is probably, you might argue, it's more important than if you're on something like the Blackpool Vic site. So that's launched. As I understand it, the launch has gone pretty well, albeit there have been some problems. I guess there always are. So my thanks go to all the staff, both in IT, but in particular in the service, that have put up with some of those teething problems. And hopefully then as we go on, we can see the benefits of that, and as we get used to the system and we iron out those glitches, then we can really start to see the benefit. And we'll obviously have further rollouts, as you can see there, so we will try and learn some of those lessons. So hopefully going forward, we won't be quite so disruptive. But I think it's a really important step, and well done. New pension scheme. Now, on this I am no expert at all, and I would emphasise that, but there are some important changes. You've had some things out with your pay slips. You can see there is a link within the brief there to a website where there's a range of information for you to look at. The pension website will be available from Tuesday the 7th. I would urge you to have a look at it. I should be having a look at it. I've already had a bit of a look at some of these things. It is confusing and complicated, but it's well worth doing, because obviously for those of us that are near to retirement, then that's a really important thing. But even if you're not, then at some point we will all retire, and it's worth working out what those changes are, what they mean to you, and what you might want to think about doing about that. So please do have a look. But like I said, I am no expert, so don't ask me if you've got any difficult questions about it. Healthy workforce. Just a bottom note there, that one of the things that's in the 5-year plan, it's one of those things that's a bleeding obvious point to make, which is that it would be really good if, as a society, we were living a healthier lifestyle. Be good for us, be good for the NHS, be good for the economy, be good for all sorts of things. And obviously, as a healthcare organisation that employs 60,000 people and is one of the biggest, if not the biggest employer in the area, then really we should try and set an example in terms of working with our staff. So we've set up a task force. We've also put out some survey opportunities for people to come back to us and tell us what they do, what would work for them. So we'll be launching a website soon to try and get that programme together. We'll hopefully have some events coming up in the year, some events that will be fun, some events that will encourage people to do a bit, to a little bit more healthy eating, a little bit more exercise, and so hopefully you'll get the chance to get involved in that. And like I said, I think it is really important as a healthcare organisation that we try and set a good example there. And as I say, make it fun. It's not about lecturing people. So watch this space on that one. Appraisal. So the appraisal window opens on April the 7th and runs till the end of August. Hopefully we will have made further improvements in terms of that system, how it works. It gives people the chance to discuss what they're doing in a more personalised way. It is really important. If you can't sit down with your immediate manager and obviously get some feedback once a year about how you've done, what you're planning to do, what ideas you've got to make things better, what help you might need in terms of your role in your development. If we can't do that once a year, that's a sad and sorry state of affairs. It should be a good opportunity. I know how busy everybody is. I know some of the paperwork and some of the systems sometimes feel a bit onerous, but we need a system to record it. It needs to be standard. So please do get on to that, and as I say, it opens on April the 7th. In terms of appointments, we're delighted to welcome Anne Connolly to a new position of Deputy Director of Operations in Scheduled Care. She replaces Andrew Kent. My thanks go to Kevin Clarkson, who held the reins while we had that gap. He did a really good job, and thank you to him. Anne joins us from Liverpool, and I'm sure she's got some really great ideas from there. And we're also pleased to announce that a lady who's not just joined the Trust, but has been here for a little bit of time in an acting role, Lisa Hawken, has been appointed to the substantive position of lead nurse for Unscheduled Care. So well done to Lisa. Moving to this side of the screen, Vanguard status. You've got quite a lot of text in the box. I'm not going to read through all of it, but hopefully you all know that we are involved in two Vanguard schemes, one for the Fylde Coast and one for Morecambe Bay and the Better Care Together work. We've got that status really because of what we've already done or we've already got plans to do. And in both those areas, what we have got is a plan to work differently, to bring together services or to put some new services in to try and support people out of hospital in the community. And that might involve GPs, might involve social care, might involve, as I say, a brand new service. In a sense, that's the heart of it, and it's about those easy to say words but difficult to do, bringing things together, integrating them and coordinating them so the patient gets a better service at the end of the day. So we had some stiff competition to get into be a Vanguard site, and as I said, to get two is pretty damn good. There is some national funding available for this, £200 million. I don't know exactly how much of that we will get, if indeed we'll get anything of it. The next step is that we're going to meet up with the national team in the next few weeks, hopefully tell them a bit more about our plans, and hopefully we'll get a bit clearer on that. What I would emphasise that, as I've said, we've got Vanguard status of what we've got plans to do. Where it goes from here, I think, is an opportunity. It fits in with some of that strategic review that I talked about in terms of the messages from the board. Fundamentally, I think it's a really good opportunity for us to hopefully get some funding, but hopefully get some national expertise, get some help. That might be some help with IT systems, might be some help with, as I say, getting some experts to come down, whether it's around contracting, service models or whatever. So I think it's a really exciting opportunity for us and a reflection of the strengths that we've got. In terms of financial update, so we had a deficit of 0.8 million for February. We're forecasting a deficit at the year end of around about £4 million, just less than £4 million. We will continue with what's called a COS rating, the continuity of service rating of a 2, and that's mainly because in terms of liquidity or cash, the plan there is that we've got a bit more than we thought we would have. So that slightly bigger deficit is offset by that slightly larger amount of cash. We know that going into next year, that situation is going to be even more challenging. And our current figures, and these figures may change slightly due to the forecasts, is that by the end of next year, we will probably have a deficit of around about 10 to 11 million pounds. And as I say, those figures may change slightly. And that is one of the key reasons why we need to just have a look and I think again about where we're going and what we can do. As you know, you'll have picked up in the press, and you've maybe seen it on telly, there are a number of commitments being made to national funding as part of the election campaign. After the election in May, obviously, we will get a little bit more clarity about what that means. But one thing I am pretty certain of is that whichever the party or coalition of parties gets into power there'll still be a big challenge in public services in one way or another. But that's where we'll end up the year. And like I said, that's a higher deficit than we planned. But I think in terms of the challenges that we've had this year, it's still a very positive result. So my thanks to everyone for that. So I'm going to pause there for questions before I move on to value of the month. So are there any questions about what you heard, about either the Vanguard bid or any of the other items on the brief this morning? Pat?
I think there's just a key message missing on the Easter one, please, Derek, if we could amend it. And that was a thank you for those to those staff that are working on the Easter period.
Yeah, no, good point. Any questions? No? Okay, right, well in that case then. So value of the month is people-centred. Valuing people, valuing everyone, including yourself. And to love yourself is the start of a lifelong romance. So, what I would just like us to do for 5 minutes or so, we won't do it for too long, is I'd like to have a conversation with the person next to you. And the kind of thing I'd like to pick up on are where you've seen some really good examples of valuing people in the trust. And that might be particularly valuing staff, but particularly might be valuing patients. Where you've done something yourself that you think worked really well, as you try to just show people that you value them, or some ideas that you've got that you're going to do in the next few weeks, where you're going to try and just get across to people just how much you value them, and try and get that going in a way that maybe you've not done so before. Some ideas that you've got. So, over to you.
Understand how it works. I
mean, some bits are
rather than just get staff to contribute towards the staff.
Just get a hand up at the back.
Hi, it's Alex from Melody. Just a dead basic one, and trying not to embarrass Jane, but what jumped straight into my mind was most of my team are in 42 Winnie Hayes, and when Jane comes over to see a person, she always goes into the other rooms, even just to say hello. But they all say, oh, she always does that, and it just makes them feel that she's interested.
She's going for the gem award. The gem award.
It's a really simple thing.
And obviously it's tempting, isn't it? Because if you go across to see someone, it's tempting to go across to see them and then get on and do the next thing on your to-do list, isn't it?
I'm going to make sure they're working.
What she's ever doing.
Well, there's another hand up there, I think, Jim.
For an example, we're running the Best Place to Work groups, and we've got different focus groups, and one of Alice's staff was with us the other day, and she was commenting about how she'd gone to Ward 3 to do an audit, one of the regular pharmacy audits. I'm not sure it was a medicine management audit, and she said, despite the fact that it was an escalation ward, how the team made them feel so welcome, and the sister was superb and helped, but used it as an opportunity to learn as well, because it was something she hadn't done before. And she said how that team made them feel coming on, where she said, you can imagine with it being an escalation ward and sometimes staff are cobbled together, but there wasn't that feel about it at all. They were made to feel very welcome as a team going on there. So I did ask her to share that back with the matron and with Lisa, just to sort of send that positive message back, because I thought that was a really nice example of where staff are under stress and in a very difficult environment, but they still had the time to look after another member of staff that came onto the ward.
Thank you very much.
Hi, my name's Emma Brennan. I prefer critical care and emergency medicine research. I think we need to be immensely proud of the staff down in A&E. The client groups that we get in, such as the alcoholics or the drug overdoses, the way the staff work with them when the patients are at the lowest point of their lives, if they've come in for that reason, the way the staff handle them and make them, look at how they can improve their lives and all the different services we've got down there. I think that's definitely something that, it's very people-centred and very, something we should be very proud of.
Thank you. Thank you for that. Tim, you're looking at me.
Well, Alistair was telling us about what they do in pharmacy in terms of focus group. It's not led by the managers, it's led by the...
Yeah, I was just saying, it just picks up, I guess, with the staff survey, Gary, and just over the last 2 or 3 years, we've tried to take it as a positive piece of work rather than just something encouraging staff to do to take a tick box. So we've done for about, this will be the 3rd year really, and just trying to get a diagnostic slice of the department, just 6 or 7 people, but led by one of the band 6s, senior technicians, and really take that as a piece of work and take the views and get some engagement and positive outcomes, and where that's improving working environment, where that's improving sort of access to training, whatever, and have that very visual in terms of an action plan on one of our display boards, and just trying to and encourage them each year to see that as a result of to participate in the survey there has been changes and improvements as well.
No, it's a fantastic idea. There's nothing makes you feel more valued than someone listening to you, and then actually doing something about it is pretty good. Right, okay, I won't go around and ask everybody, but that's really good. So, okay, any last questions? Now people have got going. Right. Yeah.
What about Parkwood Building? What's happening with it?
Well, it is being looked at. Is a simple answer to that. There are various options available in terms of what to do with it that range probably from demolishing it to using it for something else. There's obviously a debate between us and the Mental Health Trust then about those options as well. I don't know whether or not Wendy wants to just give an update in terms of that thinking and where it's at.
Well, I mean, I think everything you said's right. We're currently looking at with Lancashire Care at the building, because they own the building, not us. And we're looking at whether we transfer it back. But obviously, all buildings come with a cost.
I mean, in a sense, it comes a little bit into the strategic review, because I think if there's a good reason to keep that building, do something with it, I think it probably would need a little bit spending on it, no matter what you did with it, because I'm not saying there's anything wrong with it as such, but it almost, and obviously if we were taking it on and we were buying it, if you like, we'd obviously want to get it checked out and surveyed, and I'm sure there'd be a cost, you know, that arise from that. If it's not going to be used, obviously it would be silly just to keep it there, and then obviously you'd be more looking at the potential to demolish, and then you might look at what you might do with that space in that regard. But in a sense, I'd rather not make the decision until we've done some of that strategic work, because that might lead us to think we could do something with that building. And obviously in terms of its situ on site, it's in a pretty good situation in many respects. But thank you for the question, it's a very good one. Are there any other questions? No? Okay, thank you very much, have a lovely Easter.